Hello, everyone. I'm very pleased to be joined today by Prime Minister of Iceland, Katrín Jakobsdóttir. I hope I pronounced it correctly. Madam Prime Minister, thank you so much for being with us.
Thank you, and it was pretty close, the pronunciation.
Why don't you tell us actually what your last name means and how you would pronounce it?
Well, my last name is Jakobsdóttir, and it means daughter of Jakob, because in Iceland we have the tradition we are named after our fathers, sometimes our mothers though, too.
Well, thank you I tried my best. Hopefully I'll get it when we say.
It was good.
Thank you. So I'd love to talk to you about the strategy that you all have followed during this pandemic. Where I live in New York, we're entering our third month of shutdown. Schools are closed. Restaurants are takeout only for the most part. It's not clear when many of us will be back in the office. So how would you describe Iceland these days? What is life like there?
Well, we are gradually lifting restrictions. We have been now down to 0 infections several days in a row. There have only been three new infections, I think, this month in May. So, and we have been down to 0 now for several days, but that's something that we are just continuing to follow very closely. We still have people in quarantine, but we are lifting the restrictions. People are attending work, but we are still maintaining that we are doing a lot of tests. We are still tracing all new infections, even though there are not many of them. We are still using quarantine. So we are maintaining some social distancing.
So it's been obviously positive, but what strategies did you employ at the very onset of the pandemic that really helped you keep it under control and keep the spread at bay to a certain extent?
Well, we started our preparations quite early, actually. But it has been a work in progress, really. We have been learning as we go by. And we began by testing, and then we actually increased the testing a lot. We did that by actually entering into a collaboration. So the public health services were doing a lot of tests, but we also had a private company in health sciences doing a lot of tests. The tests were free for all people living here, so people could have a test without having, they didn't have to pay for it. So we have actually done well over 50,000 tests here in Iceland. There are only 350,000 people living here, between 350 and 360. And then when people were actually infected, everybody they had met were put into quarantine. First, we did that by just really asking them who they had met, and then we used the old-fashioned style of just using the telephone, calling everybody, say you met an infected person, you have to go into quarantine. And then actually we designed a tracing app, which we have encouraged people to use, so it's easier to trace really where they have been. And obviously we also implemented the rules of social distancing. In Iceland, actually, we never closed down primary schools or kindergartens. We kept them running just with limits, if you could say that. So actually they had fewer students at the time. So there were limited services, but they stayed open.
When you say limited services, what do you mean exactly in schools?
Well, for example, my sons went to school for 2 hours a day instead of being the whole day, really. So they actually could continue their studies by using technologies, learning more at home, but always met their teacher every day, really.
And then, so when they met their teacher, not all the students were there at the same time. They were in shifts.
Yeah, there was a 20-person limit, and you only could meet people from your own class. So we have actually used the social distancing method a lot.
In the U.S., we've seen a lot of resistance, people not complying with orders, etc., getting quite angry about it, protesting. Did you see anything like that in Iceland?
No, I think actually you could say there was an overwhelming support for these actions that were taken. And I mentioned the large amount of testing that we have been doing. Actually, I got the latest data here. More than 57,000 people have been tested. And actually, people decided that they wanted to get tested. They stayed in quarantine. We have had maybe a few bars that tried to open up before they should have, or something like that. All relatively, I would say relatively very few incidents. Some people tried to sneak into a closed swimming pool before the swimming pools were opened. But Iceland is, of course, we're a small country. What we sensed during this pandemic here in Iceland was that there was a great solidarity. And maybe because we are an army, we don't have a military in Iceland. We are really focused on that we are a very liberal society. So actually you could say that the responsibility was placed on the shoulders of each and every one of us. And the slogan was that we are all really part of this public security. We all need to be a part of it if it's supposed to work. And I think that has actually worked.
You mentioned that Iceland has a population of between 350 and 360,000 people. Do you think that the strategy that you implemented would work in a country like the United States or the UK with populations of 330 million and 67 million respectively? Why has it been so challenging, do you believe, in those countries?
Obviously, I think the size of Iceland has been a benefit for us. For example, when you're trying to trace who you have met after you get infection or are suspected of having an infection. In Iceland, we know really, we all know each other. So the tracing becomes relatively much easier in a smaller society, for example. It also, when being a small country, I think people really experience this feeling that we are in this together, that we are fighting the epidemic together. I also think that the strength of Iceland in this progress has been the public health system and the fact that it's accessible to everyone. The public health system is accessible to everyone. So I think that's a very important factor.
What would you say, obviously, after listening to this, everyone's going to want to move to Iceland, but what would you say was the biggest challenge? Because at times, I'm sure there were challenges as you faced this pandemic. What were they?
Well, first, obviously, we are not perfect. And I think when we will look back, we will have a lot to learn from this process, really, because we, like everybody else, have been learning really as we go by, because there are still a lot of things we don't know about this virus. And the challenge is always, in January, even though we had heard about some new flu coming up in China, nobody really expected that this would happen. So the challenge has really been to keep everybody on board. That was done really. One of the decisions, I think the right decisions that we made was that we have had a daily press conference where the chief epidemiologist, the medical director of Iceland, and a representative from the public security services of the police, they have been there answering questions, all sorts of questions from the media, trying to give as much information as possible to the public. And I think that has been a challenge, to keep everybody informed, because a lot of information is traveling through the internet. And this was really one of the good decisions that we made. Let the scientists really be there, and they were really ready to do this, which was amazing, to answer all the questions and be in a daily contact with the public.
You're right, though. The virus has changed so much, and they're learning in real time so much about how this works, how it spreads, the different symptoms. And so I'm sure it was challenging for them. But at the same time, it sounds as if you gave scientists the lead on this in terms of communicating with the public. You put them front and center. Is that right?
Yeah, we did that, and they also approached the project very humbly and said, we really don't know everything, and we are not going to be able to answer all your questions, but we will try our best. And I think that is something that the Icelandic public really appreciated, that these were just people trying to do their very best in their job, which was complicated.
I'm curious because I think misinformation and conspiracy theories are running rampant during this period. That obviously worked well to tamp down people believing some of the things that they were reading that were inaccurate. But did you see this misinformation manifest itself in any kinds of behavior or attitudes in Iceland itself?
I can't say I did. We are actually planning to try to see, trying to really map out if there was a spread of misinformation, but I can't say that I have experienced a lot of misinformation during the epidemic. It has really been more like a learning process where people have been trying to get a clearer picture every day and see what works and what doesn't work, really.
You are one of a number of world leaders, the Prime Minister of New Zealand, Angela Merkel, the President of Taiwan, and you all have been credited with really managing this crisis very effectively. It happens to be that you are all women. Is that a coincidence?
Well, I don't think it is a coincidence, but we have also examples of male leaders managing the epidemic quite efficiently. I think what we are seeing here and what we can learn from this is that it's important to put your ego as a politician aside and learn really from those humble scientists that have been really faced with this crisis that nobody really could expect. Be ready to admit that we are all really learning by doing, and probably we will make mistakes. And I think that has been maybe the biggest issue of leadership, and maybe that comes easier to women than men.
I was going to ask you if there's some unique qualities that women bring to the way they approach leadership, and in this case, running the pandemic. But you would say humility is perhaps one of the key factors in their success?
Yes, and also and I think the science and research has shown its importance very clearly during this epidemic. And I think that hopefully we can also learn to apply that and towards other challenges, like climate change, for example, that we put science first there.
Well, that's interesting because I know before you became Prime Minister, you were an environmental activist, and it has been extraordinary to see the transformation of the environment during this period of time, whether you're talking about fish swimming in the Venice canals or the air clearing in some of India's most polluted cities. Do you think that people will be inspired by this and that there will be a shift in the conversation about climate change in the wake of this pandemic?
Well, I think I consider it an opportunity to really revive the discussion on climate change, because climate change is right where we left it really in February. The challenge hasn't gone away. And now we really need to think how we are going to tackle that. I'm also worried that after this crisis, climate won't be a top priority for everybody. I think it's never been more important than climate continues to be a top priority for governments around the world, and we might use some of the lessons learned from this pandemic to help us in that fight against the climate crisis.
You're worried. How do you keep it on the front burner? How do you keep it a real focal point of conversation?
Mm-hmm, absolutely, because obviously we are right now in this epidemic and it takes all our attention. However, the Icelandic government is continuing with our plans of fulfilling the Paris Agreement and becoming carbon neutral no later than 2040. And we will just continue in that in our action plan to get those goals.
Before we go, I just wanted to ask you about tourism. Obviously, it's a critical part of Iceland's economy. You want to attract tourists. So my question is two parts. You plan to reopen to tourists by June 15th. What safety measures are you going to be taking as people come back to the country? And how is your government supporting workers and businesses as they challenge this economic time, particularly those in the tourism industry?
Yeah, tourism is, this is a really important part of our economy. More than 35% of our export revenue in 2019 came from tourism. So it's a very big blow for Iceland economically. So obviously, we are thinking about what we can do to support the economy by doing other things than tourism, by investing more in innovation, research, and other sectors. But we think Iceland will continue to be a good place to visit and that the tourism will revive. Now we are actually working on a plan that hopefully we can open our borders in the middle of June. However, we are still making our economic analysis of that and also our analysis of the health sector because we need to be prepared. And what we are planning to do is offer that everybody who comes here actually can get a COVID test when they enter the country. So that's really our plan, so we can actually lift our border restrictions.
And how have you been supporting workers, not only in tourism, really, but all kinds of workers whose financial states have been so adversely affected by this pandemic?
Well, we have obviously our system of unemployment benefits, but what we did was that we offered really the companies to have workers partly on unemployment benefits and partly in work. And I think over 35,000 people actually have been using this part-time work method that we are paying. The government is really paying the benefits. And then we have been supporting the companies with different sets of measures. We have also been increasing our social budget to support people because this is something that really affects everybody in society. And we have been seeing more indications of more gender-based violence, for example, domestic violence when people have been more at home. So we need to really think about and ensure that the social fabric of society is working, and that's been also one of our emphasis. And then we're thinking ahead, making more investments, like I mentioned, in different sectors to strengthen our economy for longer in longer terms.
On a personal note, as we close, what is the most important lesson that you've learned, just as a human being, going through this process?
I think the most important lesson, I keep reminding myself that on the last day of the year, the Prime Minister of Iceland always gives a speech, and there I was talking about what would happen in 2020. And 2020 has been very different from what I expected. And I think the most important lesson is you never really can tell what challenge you will meet, and you always have to be ready to learn everything again when you get a different challenge like this. You have to learn everything you thought you knew.
And that, again, requires humility.
Yes, and it also requires that you're ready to take on that task, to really revise all your ideas and do things differently.
Well, Prime Minister Katrín Jakobsdóttir, hold on. Prime Minister Katrín Jakobsdóttir?
Yes.
Thank you so much. We really appreciate your time, and good luck as you continue your important work. Thank you.
Thank you so much. It was a pleasure. Thank you.